Hello, and welcome to episode 148 of Public Interest Podcast with your host, Jordan Cooper, where we interview politicians, activists, advocates, and others who seek to improve the state of the world. We're here today with Dr. Josh Sharfstein, Associate Dean of Public Health and Practice and Training at the Johns Hopkins Bloomberg School of Public Health. Josh is also the former Health Secretary for the Department of Health and Mental Hygiene for the state of Maryland. Josh is also the former Principal Deputy Commissioner of the United States Food and Drug Administration, the former Commissioner of Health for Baltimore City, the former Health Policy Advisor to Congressman Henry Waxman. Josh is also 2008 Public Official of the Year with Governing Magazine. He's a pediatrician and the inaugural director of Bloomberg American Health Initiative. Josh, how are you doing today?
Good.
Excellent. The first thing I'd like to ask you is, what are you currently doing, or what have you ever done to advance the public interest, and why?
It's a big question. So, I'm a pediatrician,
Mm-hmm.
and I think that clinical care is
Yeah.
something that advances the public interest when you're taking care of kids.
Yeah.
Then I work for Henry Waxman, got to work on a whole bunch of different projects.
After you had your medical degree?
Yes, after I had a medical degree, and I trained in pediatrics. Then I went to work for Henry Waxman for almost 5 years. And I worked on a whole bunch of different projects related to federal agencies, immunization, all sorts of different topics. So, each of those, the question that Congressman Waxman wanted us to ask was, are we advancing the public interest? Is this something that's worth doing?
So, your father was president of the American Psychiatric Association. That may have had influence on your decision to go to medical school. But of course, one reason one might presume you went to medical school is to see patients. And then after medical school, you go straight to the halls of Congress to make health policy. How did you reconcile that in your mind? What was your motivation to go to medical school? And how did you decide to go to Congress instead of to a clinic?
Well, both of my parents are doctors. Mm-hmm. And so I grew up in a medical household. So it was... I think when I was 5, someone asked what I wanted to be when I grew up, and I said, do I have a choice? So it wasn't, I actually was not a science major in college. I did the pre-meds on the side, mm-hmm. and I wasn't quite sure what I wanted to do, but between my junior and senior years, I had a great experience volunteering in a hospital in D.C., and I decided I would apply to medical school. I spent a year in Central America between college and medical school, and then I went ahead and went to medical school.
And like Peace Corps or something like that?
It was, I worked with Project Hope, which was a non-governmental organization in Guatemala, and with the National Healthcare System in Costa Rica for the other half of the year. So
Does Project Hope actually own Health Affairs magazine?
Yes.
In which you've published many articles?
I don't know how much I've written in Health Affairs. I'm not sure I've written anything in Health Affairs, as it turns out. Yeah, but I'm a fan of Health Affairs. So anyway, I did want to be a clinician, mm-hmm. and I really love clinical medicine. And when I worked for Congressman Waxman, I saw patients the whole time.
Really?
I worked in the emergency department at Children's National Medical Center and in the urgent care clinic there, and I worked up here at Mount Washington Pediatric Hospital. I stopped seeing patients really as when I became the health commissioner, but I've been sort of clawing my way back. So I hope to see patients.
Yeah, have you seen them? Have you seen them since you've been health commissioner?
A little bit. Fortunately, there's some great pediatricians at Sinai Hospital kind of taking me under their wing. So for a while, I was seeing patients with them. Although right now, I'm kind of in the relearning some of what's happened in pediatrics since I was really actively engaged.
So there's a big gap from being a Hill staffer to being the Commissioner of Health for the entire city of Baltimore, and then going from there to being the number 2 person in the United States FDA, the federal agency, and then eventually becoming Health Secretary for a population of 6 million people in the state of Maryland. Obviously, you have to have more than just... There are many doctors who are pediatricians, yet not all of them end up going this route. And how is it that you were able to transition from one to the next? What about you caught the attention of the mayor of Baltimore, or the president of the United States, or the governor of Maryland?
Well, the most important early experience I had from a career perspective was actually when I was a medical student, and I spent some time at the Food and Drug Administration. It was when the FDA was starting to regulate tobacco. That was an effort that got struck down in a 5-4 Supreme Court decision, but I was there before that decision. And I went as a medical student expecting to sort of just be checking legal footnotes. I really wanted to help, and
Yeah.
I told them I would do anything.
Yeah.
But what happened was, after a couple days there, the staff came to me and said that the tobacco industry had written a brief arguing nicotine was not addictive.
Right.
And that some scientists at the agency had written a response, and that the lawyers who were pulling together all the regulatory documents felt like the response needed to be strengthened.
This is in the 1990s. The tobacco industry was still arguing that nicotine wasn't addictive?
Correct.
Wow.
Yeah. So I put together a recommendation on how they could restructure that part of the regulatory document, and I wound up, getting taken off the legal footnote assignment, and I got to coordinate a big part of the jurisdictional analysis for the FDA's tobacco rule. And what I learned was, I knew going in I wasn't God's gift to medicine. There were people in my medical school class who were just clearly going to be fabulous doctors and researchers and scientists, and I loved seeing patients, and I was very devoted to that. But I knew that I could see that I wasn't going to be
the star clinician.
Yeah, the star clinician say. And then at the same time, I knew that I could write, but I also knew that I wasn't like the world's greatest writer, and I have friends who are journalists and writing books. And,
right.
But what I realized when I was at FDA is I could be pretty good on the science side and pretty good on the writing side, and suddenly I could do both. And that combination of
was rare.
Skills was rare, and that even as a medical student, I was able to make a contribution. And later, when I actually worked at the FDA, we had another medical student, a young woman who I recruited in because I had gotten to know her when I was in Baltimore, and she also had this ability to write extremely well. She was a better writer than me, and she really understood the science, probably better than me. And even as a medical student, she was just suddenly playing a critical role. And so I felt like I had an insight into what I should be trying to do, which is not necessarily purely one or the other, but try to find positions where I could really be helpful at sort of the juncture of policy/writing on the one hand and medicine/science on the other.
So what were some of your hallmark achievements that you tried to, well, first of all, when you were commissioner and deputy commissioner and then health secretary, were you setting the agenda, or were there political elected officials who were more setting the agenda and you were executing?
It's always a bit of a mix. Congressman Waxman has a long, incredible record of accomplishment. So, you're working within his broad areas. But he wants his staff, or he wanted his staff when he was working in Congress, to come to him with ideas. And so it was a very entrepreneurial atmosphere. There were like 30 people on the staff. Everybody's trying to figure out what would be, a worthwhile project. And so, I felt like, I wasn't going to do something that was just totally out of something that he would do, but had done so many things in health and public health.
Right.
It was a pretty broad area for us to choose from. When I was the city health commissioner, I worked for two great mayors, and they were pretty open to ideas. And I later worked for Governor O'Malley when he was governor, and he also was very open to ideas. And he sometimes would have some pretty strong opinions about things. He was a big...
And he was the mayor while you were the health commissioner?
He hired me originally as the mayor.
Right.
So I worked for him for a year as mayor, and then I worked for Mayor Sheila Dixon for several years. And then I caught up again with Governor O'Malley when I was the state health secretary. And so Governor O'Malley, for example, was just really interested in making sure that the state had access to good data on health. And he, which I also agree with, it helps when you're agreeing with the agenda. And so, we worked together to make sure all the hospitals were engaged in sharing data, and Governor O'Malley would reach out to the hospitals that were kind of the last ones to join the effort. But we got all the hospitals engaged, and Maryland has one of the best health information exchanges in the country as a result.
How did staffer for Waxman, Joshua Sharfstein, come to the attention of then Mayor Martin O'Malley of Baltimore City?
I just applied.
You applied for the job?
Yep.
It was just merit-based. You just thought you were the best candidate who applied.
I didn't think I would be the best candidate. I actually was living in Baltimore and commuting down to Capitol Hill on the train.
Why were you doing that?
Because my wife was a fellow here at Hopkins.
Oh, I see.
And so... and my parents are up here, and we had little kids. So I thought I also had gotten quite interested in public health through my work for Congressman Waxman.
Right.
And I thought it would be an interesting thing to do to interview for the job. So I was really just hoping to get an interview and just get a sense of what local public health was like. I did not expect to get the job. I said to Congressman Waxman, I'm going to be applying for a job that I don't want and I won't get. And he said, we'll see about that. And
did he write a recommendation?
It wasn't so much a written recommendation.
How old were you?
I think 36.
It's a pretty nice job promotion.
Well, that, by Baltimore standards, I was old. Peter Bailenson was much younger, as was Lena Witt.
Also a former guest on Public Interest Podcast. So you said you're very data-driven. How did you become, big data is the word on the street these days with public health and healthcare transformation and increasing value in healthcare. Data-driven healthcare decisions and public policy obviously is something that has been really a catchword, but hasn't always been that way. Why? What about big data how did it first catch your attention? How did you get involved with that? And then how did that catch Martin's attention, and how did partnership?
Well, Mayor O'Malley created CityStat, which
right.
is the use of data for more effective city services.
Mm-hmm.
And so I really worked in the public sector under performance management based on data when starting with my job for him. So I became used to measuring whether things were working, asking tough questions when things weren't working, and sort of the whole aura of this is about delivering results. And that's something that I certainly carried with me to FDA, where I helped set up FDA track.
Josh just pointed for our listeners to a FDA track banner on his wall.
Yeah, and then at the city, back at the state on state stat.
Mm-hmm.
And so, the idea of we want to know what's working, what isn't, is really come naturally to me, because that's really the only way I've been in administrative positions, is that expectation that we'd have to defend what we're doing based on data.
So as we approach the end of this abridged podcast, I'd like to ask you a final question, which is to speak about your years in public service and reflect upon why it is that you have sought to advance the public interest through public health, why that has been such a priority for you, why that might have been a priority for Congressman Waxman. What exactly has been driving you to improve the lives of other people throughout your own life? And then at the end of your life, what do at the end of your career, what do you hope to have accomplished through all of your different roles in the field of public health?
Well, to the few questions there, I would say to the first question, I find it incredibly gratifying to contribute to improvements in health at a community level. When we had declines in infant mortality in Baltimore, declines in drug overdose death rates in Baltimore, that was just a great thing to be a part of. You just know that there are people out there. They may not know that their lives were saved or their children's lives were saved, but they were really saved. Mm-hmm. And I found that, I certainly love clinical medicine, and you get the excitement of really helping in pediatrics a child thrive. There's nothing really that comes close to that. Mm-hmm. But if there is something that comes close, it's helping a community thrive, and it's a great feeling. It's a great intellectual challenge. It's a great political challenge. But when you accomplish something at a community level, you know that you've made a difference. And so, it's something I pursued at different levels of government and now here at the school, because I think it's really important. To your question about at the end of my life, at the end of my career, when I look back, the truth is I tend to live in the moment. I'm just going to try to do as many things as I can, help in ways that I can. One of the things I've learned is it's hard to know where the opportunities are in advance. You may come with a particular plan, and sometimes you can work out that plan, but then there's all kinds of opportunities that present themselves. And if you say, well, the one thing I want to do, and its success or failure hinges on X, and then X is impossible, then you may wind up unnecessarily limiting your options. So, I'm looking forward to it. I really enjoy being at the school and teaching students and doing different projects. I work with cities and states and health commissioners and others to try to make progress on some of the big challenges of our time. So I'm enjoying it, and sort of take one day at a time, not worry too much about the end of my life right now.
All right. Well, that has been Dr. Josh Sharfstein, Associate Dean of Public Health Practice and Training at the Johns Hopkins Bloomberg School of Public Health, former Secretary of Maryland's Department of Health and Mental Hygiene, former Principal Deputy Commissioner of the United States FDA, former Commissioner of Health for Baltimore City, former Hill staffer, and the inaugural Director of the Bloomberg American Health Initiative, who speaks about saving lives, whether on an individual basis as a clinician or on a broader scale, on a population level, as a public health official, teaching the next generation of public health professionals as a professor and a administrator at the Johns Hopkins Bloomberg School of Public Health, who speaks about the necessity for taking chances, being flexible, being able to adapt your plan to circumstance as the unforeseeable comes to pass. For Josh, it's all worthwhile because at the end of the day, saving lives is a powerful thing, and that there's no more perhaps concrete example of really having made an impact and knowing, as George Bailey found out in It's a Wonderful Life, that you being alive really mattered, that your life and your work and your effort really contributed to something that made the world better for others, who really made the world possible and livable for others when you speak about reducing an infant mortality rate. So Josh, I'd like to thank you so much for joining us today.
Okay, thanks for having me.
And that has been episode 148 of Public Interest Podcast with your host, Jordan Cooper, where we interview politicians, activists, advocates, and others who seek to improve the state of the world. Remind you to subscribe at publicinterestpodcast.com. Listen on iTunes, Stitcher, SoundCloud, Blueberry, Player FM, Facebook, Twitter, LinkedIn. And should you wish to speak to Josh, you can call 240-630-0380, and you can leave a voicemail that will be transcribed and sent over to him. Thank you so much for joining us, and we will talk to you next time.